You're listening to Battling Opioids, the podcast. Battling Opioids, the podcast, now on Apple Podcasts, Stitcher, Google Podcast, TuneIn, Amazon, YouTube, and now radio.com.
Welcome to Battling Opioids, the podcast. I'm JADonnelly, and on the phone we have Cammie Anderson, who has worked as a drug and alcohol prevention coordinator for the past 27 years, and Jessy Miller, director of drug and alcohol programs at the Robinson Counseling Service Center of Wyoming Valley. Good morning. Why don't we start out with Cammie? Cammie, why don't you tell us about what changes you have seen within education?
What I see a lot of is a lot more younger kids affected in their homes. So some of the stuff that we're dealing with in education now is my caseload has really gotten heavy with kids in our primary center, our elementary buildings, who have either lost parents to this, or parents are incarcerated, or they're being raised by grandparents. So I think I'm dealing with much younger caseload. We have also taken the education of prescription medicines down to much lower grades than we had in the past.
So, Jessy, jumping over to you, what type of new treatments? There's a lot of things coming across the board these days with medical marijuana could be a possibility of helping out opioids. And what new treatments do you see for families, children, etc.?
Well, I can speak for what we're doing here. With the opioid crisis, and we've kind of taken this public health approach to it and utilizing medication-assisted therapy. It's been invaluable. I think the important part is that we need to make sure that we're treating these individuals, with both, the medical piece of it being the pharmacological, Suboxone, buprenorphine, methadone, or what have you, but also in coordination with treatment. I think oftentimes we give individuals that are struggling, and in particular families who have been through this crisis in their lives, this false sense of hope that the medication is going to alleviate all of the concerns and get their loved one and their family back together. And unfortunately, as much as the medication has really helped to save lives and to prevent overdoses, we still have a lot of damage that's been done to the individual and to the family, and that's where it's important to really, enhance or put the pressure on for the treatment part of it, and not just for the individual, for the family as well. Because at the end of the day, we want to heal the entire person, and that includes their family, their children, and ultimately the community.
Now, what about treatment with foster children these days? Anything different with the foster care and grandparents who are also taking care of children these days? They're taking care of children who have opiate addiction. Any new programs?
I think, I speak locally in Luzerne, Lackawanna, Wyoming counties. There's been a recent, over the last few years, a real big push to recognize these families that have sort of been forgotten in this. We have children who, due to this opioid epidemic, have ended up in foster care, or what we call just an alternative caregiver. That could be a foster parent that's unknown to them. It could be a family member, or oftentimes what we're dealing with in Luzerne and Wyoming counties in particular is a lot of grandparents who are now going through this raising the next generation or the second generation of children. So we've seen a big push to create sort of what we see on the treatment side is a bit of a fellowship. And, we're educating grandparents on the dangers, things that they didn't have to think about, like securing their own medications and the risk factors associated with it. But also, some of the behavioral problems and the detachment that we see from, children, because unfortunately, sometimes we expect kids to be happy that they're in a safer environment, but we need to remember that these kids, they ultimately want to be home. And, unfortunately, I think it's unfair that we put caregivers in these roles without providing them with the resources and the support that they need to not only to take care of themselves, but also provide a better and safer environment for the people they're caring for.
I think I'm going to add to that, or pretty much just try to repeat what Jessy said. I think one of the things we really need to do is to educate these grandparents and people that are the people that are raising these kids. And then the other thing is kind of really be there as a support system for the children that are dealing with all this.
And I know that, the children and youth offices in Lackawanna, Luzerne, Wyoming County, they've really taken a proactive approach to make sure that they're offering their resource families that are caring for these kids opportunities to get community-based services or in-home services. Because oftentimes, we want to educate them on the risk factors of substance use and the dangers of drug and alcohol use, but a lot of times the issues that they're displaying are more behavioral problems. And oftentimes we wait until they get into the schools and we start to see things with truancy and lack of motivation in the school, or just a detachment from the school as a whole. So I think the more that we can get kids into a healthy therapeutic environment, to let them talk about this separation, because it's a big deal to these kids. And I think oftentimes, or at least recently, with the opioid epidemic and the funding, a lot of the effort and the attention has been put on the user. And we can't forget that there's an entire population of young people who have unfortunately suffered the consequences of this epidemic.
We recently were doing a story at the New Roots Recovery Center in Wilkes-Barre in Luzerne County, and they have some new treatments to help people cope with addiction through art and therapy and music. Have you heard much about that at all?
Well, I will speak, with the New Roots program that's here in Luzerne County. We are blessed to have been provided the opportunity to bring a recovery support center into Luzerne County. These programs are invaluable. Oftentimes, we provide an individual with medication to help reduce the withdrawal symptoms or their desire to use. We put them in therapy once a week or, a few times a week, and we work on a lot of issues, but then we send them back out into the community. And, knowing that there's a safe, easily accessible place that offers these outlets. Because ultimately what would be the reason to get sober if your life was going to still be the horrors and the crisis and chaos that it once was? Our goal is that when we get individuals into recovery, we want to increase that feeling of self-sufficiency, and through things like art therapy and music therapy, it gives the individual a chance to relax and take the focus off of, their problem right then and there. So it's an outlet, and and I think New Roots is a blessing for our community, and I'm glad to see that more of these centers are opening up across the state.
Recently, it was stated that the overdose level dropped 17 to 18% within Pennsylvania. What are your thoughts on that?
Well, speaking personally and from my experiences with 16 years or 15 years of work in this, we've done a tremendous job at reducing overdose deaths and reducing the admissions to hospitals for overdoses. And that's been 100% on the back of medication, and it's been a blessing. But one of the things that we're seeing right now is without this push to ensure people are getting the therapeutic interventions that they need in addition to medication, we haven't seen a downturn. So, that's the easy way to put it for us, is just because there's medications out there that individuals are using to help with their opioid withdrawals or cravings, our doors are still packed. Individuals still need treatment. And we're seeing, recently a large resurgence of methamphetamine in Luzerne and Wyoming County. And this was something that we saw 6, 8, 9 years ago, and it sort of plateaued in the midst of this opioid epidemic, but now we're starting to see it come back again. And I think we need to change our view that this isn't so much a drug problem. And oftentimes when we look at it that way, we're pinpointing a drug, a specific drug. We funnel all of our treatment into this specific drug. It's more than that. We need to treat these individuals holistically, from a physical, emotional side, so that way they feel better. Because ultimately, if the individual is not doing well emotionally or physically, despite being on a medication to help with their opioid use, they're going to go back. They'll find something else. And I think we're starting to see an increase in other drug use. And unfortunately, it comes with the same impact to the family and to the community as the opioids did, but we are saving lives by keeping them on the medication, so I'm a proponent for that.
And I think if we look at prevention, I think the importance is that, yes, we absolutely needed to educate and talk about medicines and kind of deal with what we're dealing with. But what prevention does in schools, I know what I'm doing in my school, is we don't just look at certain drugs. We talk about a lot of different drugs, but we also talk about those coping skills and feelings and how we deal with that. So we don't need to look to a chemical to feel better, because Jesse's right. It isn't necessarily a drug problem, one drug. It really is a whole, we need to look at the students and deal with the whole issue.
So how does one dismiss the stigma attached to drug abuse?
I'll speak on our end from a treatment side. We have spent, a great deal of time and resources and energy trying to educate our community. On a national level, on a state level, when we look at, we're fortunate to the efforts that Pennsylvania has put forth to help address this public health crisis. And I think that's really what we need to get to, is stop looking at this as a moral failing, and we need to stop looking at ways to arrest our way out of this problem. This war on drugs has been going on for decades, way before I was around. And we've made little to no impact on it. So if we continue to push this public health, approach where this is a disease, we need to treat it just like every other disease. We don't arrest somebody when they walk into their doctor's office and the doctor says you're suffering from hypertension or diabetes. What we do is we provide them with access to medication that can help reduce their symptoms, help prevent them from hospitalizations. But what we do second is we educate them. We try to put a treatment plan in place that talks about healthy eating and healthy lifestyles, becoming more active. Those are the things that are going to keep that person alive, but not just alive, healthy. And I think when we start to look at that through the lens that we're seeing on the treatment side, if we can get our community to understand that, we're going to make waves. And I will say this, I think Luzerne County has put forth an effort. We have a long, long road ahead of us to reduce the stigma. But I will give credit where it's due. I think there's been efforts, there's been task forces and coalitions that have been put in place in all of our surrounding counties to help try to educate the community. But it's a tall task, but I will speak for myself and our facility here and our local drug and alcohol commission here in Luzerne County, that the effort's not going to stop. We're going to continue to put boots on the ground and get out there and educate our community.
Now, in a final question, if you had a wish list for other needs that would help out your program and people within the program, do we need more outreach, or what would you include on that list from if you both can comment on that?
Well, I think in education, or prevention where I work, obviously it would be more funding and more people in these schools doing, K through 12 education, in being in the community, just kind of, I guess it would just be time, and that would be the other thing. I think, and it's my school does a great job of freeing up time for me to get in those classrooms, but the bottom line is they're there to educate some other stuff too. So I think it is really making time for people to come in and work with these kids, and just having, I think, more people in prevention and education, not just in schools, but in the community also. In businesses, in daycare centers, in senior centers, just really just being all over the community and educating and raising awareness about what's going on.
And from a treatment standpoint, I might be one of the few people that say this, but I think the funding is there finally. We're in a situation, at least locally, where we have the funding needed to treat individuals. We have access to resources. We have, we're fortunate in a relatively short distance from Wilkes-Barre, with Lackawanna, Luzerne, Wyoming. We've got a full continuum of care. We have MAT providers, we have detox facilities, we have inpatient facilities, we have some really great outpatient facilities. We have a local SCA who puts a true emphasis on prevention education. My wish list would be that we would be in a community where when somebody has a problem or when they're struggling, that they can raise their hand without being judged. When we can get to a point where individuals who are struggling can raise their hand and say, something's not right, I don't feel right, and I need help, we're going to get to a lot more of these consumers before it's too late. So in regards to a wish list, my wish would be that our community continues to take the efforts to reduce the stigma that we have, which in the end is going to save even more lives.
Recovery starts with a call. Call 1-800-662-HELP or visit battlingopioids.org.
It doesn't take long to become addicted to opioids. 13 Pennsylvanians die from them every day. Geisinger is committed to ending opioid addiction with both prevention and treatment. In the last 3 years, we've reduced the amount of opioids we prescribe by 50%, and we've opened 4 medication-assisted treatment centers across the state to help patients recover from addiction. Learn more at geisinger.org/hadenough.